Hello, hi, namaskara. My name is Kirtan and I am a second year medical student studying in a government medical college. Welcome to my channel Physiology at Once. Today I will be talking about the topic peptic ulcers. It is the continuation of the gastric secretion topic which I talked in the previous video. This peptic ulcers is the main topic in this chapter, gastric secretion, and can be asked as a 5-marker question in the board examination. So before starting this video, please subscribe to my channel if you haven't subscribed, because it's free and also you can get the notifications for these types of videos earlier than your friend. So in this video I will be talking about the pathophysiology of the peptic ulcers, the features of the peptic ulcer and the treatment of the peptic ulcer. So let's start. So what is the peptic ulcer? It is nothing but the ulcer in the stomach or the duodenum region. So what is the ulcer? Ulcer is nothing but the sore in the wall of the stomach or the duodenum. Sore means the hole which opens the stomach or the duodenum region for the HCl and it causes irritation. So what is the pathophysiology? Pathophysiology is nothing but the cause of the peptic ulcer. So there are three main pathophysiology: the diminished effectiveness of the mucosal barrier, the hypersecretion of the acid, and the Helicobacter pylori infection. So the first pathophysiology is the diminished effectiveness of the mucosal barrier. The mucous gel layer is thick and effectively separates gastric epithelium from the acidic content of the stomach. So this mucus is secreted from the gastric epithelium and it separates the HCl content of the stomach from the gastric epithelium. So when this secretion of the mucus is impaired due to some reasons, or when the bicarbonate production is also decreased, bicarbonate is produced from the gastric epithelium, or when the mucosal coat is mechanically damaged, the acid and the pepsin causes the ulcer formation. So ulcer formation is aggravated in cases of aspirin and non-steroidal anti-inflammatory drugs, which we can also call it in the NSAID. This is the short form. So these drugs aggravates the peptic ulcer, and also during chronic stress the cases of the peptic ulcer may increase. So the next pathophysiology is the hypersecretion of the acid. So the hypersecretion of the acid, the main causes in this are hurry, worry and curry. Hurry means the chronic stress, worry also means the same, and curry means that when you intake the spicy food, it may increase the rate of chances of the peptic ulcer formation. So the conditions causing hyperchlorhydria. Hyperchlorhydria is nothing but the hypersecretion of acid. So this is the conditions which cause the hypersecretion of acid. Hypersecretion of acid is the pathophysiology of the peptic ulcer. So the main conditions are Zollinger-Ellison syndrome. I had talked about this syndrome in my previous videos. So Zollinger-Ellison syndrome nothing means that it is the tumor of the pancreas. It can be alpha or beta cells tumor of the pancreas. The next one is the gastric outlet obstruction syndrome. In this, there is obstruction of the gastric contents into the duodenum, which causes the gastric content to strain the stomach and causes HCl secretion to be increased. Systemic mastocytosis. As you know, the mast cells secrete histamine. So when there is increased mastocytosis, means that there is increase in the number of mast cells. So when the mast cell increases, the histamine secretion also increases. As you studied in the previous video, histamine increases the HCl secretion. So there is increase in the acid secretion. So the next pathophysiology is the Helicobacter pylori infection. This Helicobacter pylori is a gram-negative bacillus. It colonizes the antral mucosa of the stomach, where it causes local inflammation and also disrupts the immune responses. It also inhibits the somatostatin secretion. Somatostatin is a hormone which controls the rate of HCl secretion. So it is like an inhibiting factor. So when this is inhibited, there is no control in the HCl secretion and there is more increased rate of HCl secretion. The antibiotic therapy is useful against this condition. So now let's talk about the features of this peptic ulcer. The most of the cases of the peptic ulcer, it is located in the duodenum, above the ampoule of water. Ampulla of Vater is nothing but the opening of the pancreatic and bile ducts. This opening, there is release of basic secretion or alkaline secretion which neutralizes the acid secretion of the stomach. So when there is neutralization, there is decreased chances of peptic ulcer. So above this, where there is no alkaline secretion, there is more cases of peptic ulcer. So the abdominal pain is experienced mostly in this peptic ulcer. That is also mostly in the empty stomach. So when there is intake of little food or when there is antacid means the alkaline solution, there is decreased abdominal pain. If it is untreated, there is hematemesis. Hematemesis nothing means the blood in the vomiting. Malena means that there is blood in the stools. Then the vomiting itself, and the peritonitis. Peritonitis means that there is inflammation of the peritoneum. So these are the features of the peptic ulcer. So what is the treatment? How can you treat this peptic ulcer? Treatment can also be divided into specific treatment, then the non-specific treatment and the surgical treatment. Specific treatment means that is drug intake. So the first one is the H2 receptor antagonist. As we know that H2 receptor is mainly for the histamine. So as histamine is the main stimulator of the HCl secretion, if the H2 receptor is blocked, there will be less secretion of the HCl secretion because histamine cannot act effectively. So these drugs, the example are ranitidine, cimetidine, etc. The next type of drugs in the specific treatment are the proton pump blocker. As you know that the H plus K plus ATPase which is present in the gastric cells help in the HCl formation or the secretion of the HCl. If this is blocked, there will be no HCl formation. So the omeprazole is the example of this proton pump blocker. So the next drug is sacralfate. Sacralfate, the example is the sucrose octasulfate. This also decreases the effectiveness of the HCl. Muscarinic blockers. As you know that the M2, M3 receptors which is acted upon by the acetylcholine hormone. As acetylcholine hormone stimulates the HCl secretion, if we block that, there will be decreased secretion of the HCl secretion. So atropine and pyrizinamide is the example of these muscarinic blockers. But there is a defect in this. As you know that the non-cholinergic fibers of the vagus nerve are predominantly more active than the cholinergic fibers. These drugs cannot be more effective. So I mean that vagus nerve has two fibers, cholinergic and non-cholinergic. You have studied this in the previous video. So this non-cholinergic fibers is dominant than the cholinergic fibers. So the cholinergic fibers acts through the acetylcholine. The non-cholinergic fibers acts through the gastric cells. So since this non-cholinergic is predominant, even if you block this cholinergic fibers action, the non-cholinergic fibers action will be still there because it's predominant. So the administration of atropine and pyrizinamide is not much effective. The next type of drugs are the Gastrin Blockers. These blockers affect on the non-cholinergic fibers of the vagus nerve. So these are more effective than the muscarinic blockers. The example is the proglumide. The next one is the antibiotics. This help in the case of the Helicobacter pylori infection. So the example is the amoxicillin. Now talking about the non-specific measures. The antacids are the first one. Antacids are nothing but the alkaline or the base solutions which is taken for immediate relief. This is for the temporary relief. The next one is the yoga therapy and other measures. There are several yoga poses and several diet changes which help in the control of the peptic ulcer. Even the intake of cold milk helps. Even if you inhibit the intake of the aspirin and non-steroidal anti-inflammatory drugs, it's helpful. The next type of treatment is the surgical treatment. In that, we can again divide it into vagotomy and the gastrectomy. These are the main surgical treatment. In the vagotomy, we can again divide into truncal vagotomy, selective vagotomy and highly selective vagotomy. In the truncal vagotomy, we directly cut the supply of the vagus trunks. In the selective vagotomy, we cut the supply of the vagus nerve to the stomach organ. And in the highly selective vagotomy, we cut the vagus nerve supply to the specific cells of the stomach. So the highly selective vagotomy is more efficient. The next type of surgical treatment is the gastrectomy. In this gastrectomy, we cut the antral region of the stomach. Since the antral region is the most vulnerable place for the peptic ulcer and it is the HCl secretion is most increased in this place. So when there is gastrectomy or the cutting of the antral region of the stomach, there will be blockage of the stomach content in the stomach itself and there will be no flow of the content into the duodenum. So it is followed by the gastroduodenostomy or the gastrojejunostomy. So this helps in the movement of the food content into the duodenum. So that's it for today, guys. If you found this video informative and useful, please like, share and comment, and also don't forget to subscribe. Thank you.